All right, we want to talk about Mohs micrographic surgery. Question 7. Patient has basal cell carcinoma on his upper back. A map was prepared to correspond to the area of skin where the excisions of tumor will be performed using Mohs micrographic surgery technique, where there were 3 tissue blocks that were prepared for cyrostat, sectioned, and removed in the first stage. Then a second stage had 6 tissue blocks, which were also cut and stained for microscopic examination. The entire base and margins of the excised pieces of tissues were examined by the surgeon. No tumor was identified after the final stage of the microscopically controlled surgery, where procedure codes are performed. Up on the screen, I did make sure I put the code ranges and what we need to highlight and take a look at. So we want to start with code 17313. We want to talk about trunk, arms, or leg, first stage up to 5 tissue blocks. Why that code, right? So up there where the first sentence is, where it say patient has basal cell carcinoma on his upper back is what we're looking at. So with the code 17313, trunk represents the back. So now that we know this is where we starting at, now for the first stage up to 5 tissue blocks. The third sentence is say there were 3 tissue blocks that was prepared for cyrostat, section, and removed in the first stage. The first stage up to 5 tissue blocks, that would be code 17313 because there was 3 tissue blocks that were prepared. So here's the trickery. There was a second stage, and the second stage had 6 tissue blocks. And we want to now know within code range 17314 through 17315, why is that? So let's show why then. Right now, we're trying to figure out between the differences. The difference is with code 17314 is for additional stage after the first stage up to 5 tissue blocks. So we want to talk about the stage. So there are only 5, right? It's only 5. It can go up to 5 tissue blocks for that stage, that first stage. Now after the 5 tissue blocks, anything after that becomes an additional block after the first 5 tissue blocks. So that's where code 17315 come in at, because it's additional. It's an additional block now. It's more than the additional amount that they gave us. So I just wanted to let you know how they will perform a trickery. Let's get to the answer choices. So they gave you answer choice A, B, and D, with the answers choice of code 17313 already at the beginning, because that's where it's supposed to be at. But then it starts to get trickery with question A, answer choice A, that says 17314 twice. So that's the thing. You're not supposed to use that code twice, only one time. Make sure you all are reading your guidelines with Mohs so you won't make that mistake. That is where 17315 code comes in at, because it was an additional block after the first 5 tissue blocks. So I hope this makes you understand why answer choice D was selected, and I also hope that you go in and take a screenshot or whatever you need to. Save this video, like, comment, and share so you can come back to it if you have to. But I hope this make you understand that this is going to be on the test, and that you need to go ahead and highlight this in your book, notate it in your CPT, or whatever you need to do to remember it, because this will be on the test. I am going to show you how I highlighted everything in my CPT manual, so you can highlight it in yours that way as well, and keep a minder.